everybody, this is Dr. John Hayes. You're listening to Beating Neuropathy and Chronic Pain here on 95.9 WATD. In tonight's show I have the pleasure once again of having Dr. Brian Petrie with me. Brian, welcome back to the show.
Thanks for having me again, John.
Of course, you were with us last week. You're from Neuropathy, Bristol County. And in last week's show we were talking about, of course, neuropathy and chronic pain. I thought what we would do in the beginning is for people that might be new to our show is to just talk a little bit about neuropathy and what it is. I mean, you know, from a very, very simplistic perspective, you know, we tend to, as clinicians, use big words, and it's not always necessary, but neuropathy basically means neuro, which is the nervous system, and pathy, P-A-T-H-Y, means something's gone wrong. So neuropathy really is nerve function gone wrong, so to speak. And, well, you're a neuropathy expert, so tell our listeners about some of the more common causes of neuropathy that you see in your clinic.
Okay. We actually get that question a lot. The patients ask, what's
Right, what
neuropathy?
Right.
Because they see it in the office. I basically explain to them that it's just pain, numbness, tingling, loss of function in the hands and feet. And usually if they're suffering from that, they know what I'm talking about.
Yeah, I mean, that's the thing. I mean, I tell patients that if you don't have neuropathy, you don't want it. But
right.
It's very, very miserable. Very miserable. There's over 20 million patients in this country alone that suffer from it. It's oftentimes secondary to diabetes. As we well know, 60% or so of patients that have diabetes will ultimately end up with neuropathy. Patients that undergo chemotherapy. We do want to talk a little bit more again about the whole issue of body mass index and weight on tonight's show with regard to not only health in general but neuropathy in particular, because it does have a really big bearing. So I do want to make sure that at the beginning of tonight's show, though, if somebody listening to this show wants to know a little bit more about what you do and where you are, how can they find you?
They could go to neuropathybristolcounty.com or bristolcountychiropractor.com. Our office number is 508-821-4049.
And your office is located in?
Rainham, Massachusetts.
Okay.
Route 44.
Okay, super. So let's try to pick up a little bit where we left off last week. We were talking about the components that we use in the neuropathy GR treatment centers to help patients with neuropathy and chronic pain. And we spoke extensively last week about the manual therapies, in other words, the chiropractic care, the specialized form of soft tissue work or deep massage, for lack of a better word, that you do called Graston technique, and that was very helpful and very fascinating actually. And there's two other components. We use the low frequency nerve stimulator, okay, and we use metabolic rehabilitation.